Now that you've gathered your staff, you want to take some steps to manage your success. So first of all, you want to make sure that all your lines and IVs are free, and if there's anything that can be disconnected to more safely move the patient, such as the subglottic suction or extraneous IV solutions, you should do that now. You need to make sure that the arterial line is secure and that will be underneath the patient for a brief period of time when you're turning. You're going to need to have your pillow at hand, and the respiratory therapist and another nursing or provider staff will need to be able to manage the head and the airway safely. You need to have additional sheets, and after the EKG leads are taken off, you need to spread the sheets and the wedge pillows out so that we can start our first step in turning the patient. If the patient has femoral lines or other lines that will be wrapped up in the wedge pillows, you may want to just save the positioning with the wedge pillows for after the patient has been turned. At this point, we're going to take the top sheet and we're going to secure the bottom and top sheet together by folding them, ensuring that we're not covering the ET tube so that we can safely ensure that the ET tube is turned without being dislodged. Most patients will already be on the ventilator. For our purposes, we are using the ambu bag. After you get your patient's sheets situated, you're going to decide which turn you're going to do safely. If you have a patient with significant left lung disease, you may not want to turn them on that side. For our intents and purposes, we're going to turn the patient down onto the left side first before proning. So you want to make sure that you have enough room on the side that you're turning. So first we're going to do a shift towards the right side. And the person that has securement of the ET tube should always direct the turns. So on the count of 3, we're going to slide the patient to the right. 1, 2, 3. Excellent. The next step will be to get the patient onto their left side. First, you want to make sure that your lines are all still secure and that your ET tube is secure. While they're turning, you're going to need to turn the patient's head and the ET tube at the same time. And then you're going to utilize your proning pillow or some sort of rolled towels in order to secure the head. All right, on the count of 3, we're going to get up onto our left side. 1, 2, 3. Excellent. And then one more turn, we're going to go on our belly. 1, 2, 3. After ensuring that your ET tube and lines are secure, then you can sufficiently position the patient by turning them or pulling them so that they are not on the edge of the bed. Next, you want to secure your sheets and get the new leads on the patient. Patients that you think are high risk to arrest during this procedure, you can have pads on for quick CPR. If you notice that the patient is decompensating, if it is something that can be managed transiently, typically patients will settle out if you give them some time and possibly increase ventilator support or increase vasopressor support. For our intents and purposes, the patient is a mannequin whose arms can't be straightened, but you want to put the patient in the army crawl position, which would have the arm up by the side that is turned towards the ventilator. So the ET tube side, the arm would go up. We're not able to do that. Drawbacks to proning include dislodgement of the ET tube or other lines, and also pressure ulcers from the pressure on the joints that we cannot see. So sometimes it's beneficial to pad things like the ears, jaw, and forehead to ensure that there's no breakdown. You also want to make sure you're turning the patient every 2 hours from left to right, just taking your wedges from one side to the other, and also making sure that the bony prominences do not have a lot of pressure. So rolled towels are helpful for the elbow joints, for the shoulder joints, and also under the feet. That's it.